Hello, everyone, and welcome to this installment of the Medicare Basics or Transitioning to Medicare presentation, which is being offered by the Baltimore County Department of Aging SHIP office. That stands for State Health Insurance Assistance Program. And what we do is we help educate people all about the different parts of Medicare, the enrollment periods to sign up for Medicare. Basically, you've got a Medicare question. We have an amazing team of volunteers who can help you navigate all of those different twists and turns that may come about. So this presentation is really geared for folks who are not yet on the Medicare program, or maybe you just signed up. So this will be really, really important for you, and it does include a ton of information. This presentation is about 90 minutes long, so keep that in mind. If you need to go grab a drink, something to eat, or run to the restroom, please do so before we get started, just so that way you are ready to go for the entirety of our in-flight presentation. So without further ado, let's get started. Now, I myself am not a teacher by trade, but I like to pretend. So I like to go over some terms and definitions before we get into the nitty gritty of the presentation. And I do that because I think it's really important to make sure that we all have a baseline understanding of the different terms and definitions that are going to come up within the presentation. So the first term is coinsurance. That's an amount that you may be required to pay as your share of the cost for services after you pay any deductibles. Now, you might be thinking, okay, so then what's a deductible? Your deductible is the amount that you must pay for health care or prescriptions before original Medicare, your Medicare Advantage plan, your Medicare drug plan, or any other insurance that you have starts to pay. Now, copayment is something that we're all pretty familiar with. It's an amount that you may be required to pay as your share of the cost for a medical service or a supply. A prime example could be a trip to the doctor's office resulting in a $20 copay, or maybe you go to the pharmacy to pick up a prescription and that prescription comes at, let's say, a $5 copay, a pretty easy trip to the pharmacy, I might add. That's a copayment. Coinsurance, as we discussed earlier, typically is a percentage rather than a set dollar amount like copayments. Now, last but certainly not least would be your premium. That's the periodic payment to Medicare, an insurance company, or a healthcare plan for your health or prescription drug coverage. What that means, because that's a whole lot of words, is that's the amount that you pay every single month to keep that insurance active. And yes, you do need to make those payments. In some instances, you may wind up qualifying for different financial assistance programs that can wipe those away. We'll talk about those later. Now, if you're ever in a situation where maybe you heard some terms that you don't quite understand, or maybe even an acronym, because there's a lot of different acronyms that are used within the Medicare program, I highly recommend checking out medicare.gov/glossary. It's a fantastic online user-friendly tool. Now, I like talking about the marketplace. The marketplace is one of those buzzwords really regarding health insurance as a whole, I would say. But a lot of folks who are coming onto Medicare ask us, well, do I have to get Medicare or can I just get something from the marketplace? Well, the marketplace is designed for people who are under the age of 65, who are not on Medicare, and who don't have an active employer health insurance benefit. Okay, so if you're working and have health insurance, you also would not be able to get the marketplace plan. So really the idea is once you're eligible for Medicare, you get Medicare. It's actually illegal for someone to sign you up for a plan on the open market. Now, let's talk about how somebody becomes eligible for Medicare, because sometimes folks have this misconception of, well, you turn 65, that's it. But that's actually not the case. So in order to be eligible for Medicare, you must be a U.S. citizen or have had your resident visa and have lived in the United States for 5 consecutive years. And first up, be 65 or older and receive or be eligible to receive Social Security or Railroad retirement benefits, or if you yourself do not meet the eligibility criteria to get Social Security or Railroad retirement benefits, maybe you didn't work, you didn't have the work history, then your spouse can have that criteria, and you would be able to then get Medicare. Or you can also qualify for Medicare under the age of 65 if you've been getting disability benefits for at least 24 months. or if you have kidney failure, end-stage renal disease, otherwise known as ESRD, and last but not least, if you've been approved for Social Security disability with a diagnosis of ALS, and that's Lou Gehrig's disease. So let's talk about the basics of Medicare, if you will. There's two main parts of what's called Original Medicare, and it's called Original Medicare because back when the program first started many moons ago, there was really only two parts. It was just A and B. The Medicare Advantage plans, the drug plans, all that came much later. So part A is everything inpatient, that's your hospital insurance. Part B is everything outpatient, and that's your medical insurance. I'll talk in more detail about what's actually covered under each of those a little bit later in the presentation. Now, there's no premium for Part A if you or your spouse worked 40 quarters, which is about 10 years of working and paying into Medicare taxes. So that's a good thing, right? You get the insurance. It's if you're inpatient in a hospital and you don't have to pay a monthly premium for it. Good stuff. Now, there's Part B, though. Part B does have a premium. It actually just went up for 2024, and it will be $174.70 per month. Some folks may have a higher monthly premium for Part B because they have what's called an IRMA. That's an income related monthly adjustment. And it means that if your income is over a certain amount, that you will have a higher Part B premium. I believe for a single individual, it's around $103, if I'm not mistaken, or excuse me, $103,000, pardon me, per year. So if your income is about that much as a single individual, well, your Part B premium may be higher. If you have questions about that, you can contact Social Security. Now, is Medicare enrollment automatic? It's actually not, and a lot of people assume it is. So, enrollment is only automatic for folks who are signed up for and who are currently receiving Social Security benefits due to age, or if you are receiving Social Security disability benefits. So, basically, if you're getting a Social Security check, then you will be automatically enrolled in Medicare. So what happens when it's automatic? You'll get a packet of information and your Medicare card delivered to your door 3 months before your 65th birthday or 3 months before the 25th month that you've been receiving Social Security disability benefits. You're automatically enrolled in Medicare A and B if you don't take any further action. And we'll talk about why you might want to take further action. And your coverage will start the first day of the month that you turn 25 or the 25th month that you had been receiving those disability benefits. Now, how about when it's not automatic? Because let's face it, a lot of people are choosing to work longer. The age to get full Social Security is getting higher and higher, right? So then it's not as connected to Medicare enrollment as it used to be, because when it was falling around 65, it was kind of like, okay, get Social Security, get Medicare. But now, if the age is later to get full Social Security, more people are waiting to take Social Security, and that means that their enrollment in Medicare is not automatic. So if it's not automatic, you need to contact the Social Security Administration 3 months before you turn 65 in order to apply for Medicare. You have a longer period of time than just that 3 months, but early bird gets the worm, and you'll see why. You can either go online to apply for just Medicare A or A and B, that's ssa.gov, or you can call the Social Security Administration, 1-800-772-1213. Now, some folks might be interested in delaying enrollment of Medicare, or in Medicare rather, at the age of 65 or the 25th month of disability. Prime example, maybe you're still working, right? If I'm still working and I'm covered under my employer benefit, well, do I really have to sign up for Medicare? Let's talk about it. If you or your spouse is actively working and you have group health insurance through that employer and the employer has 20 or more employees, you can delay enrolling in Medicare at the age of 65. If you're under the age of 65, and you have a family member who's actively working, you have health insurance through that employer, and the employer has 100 or more employees, you can delay enrolling at the 25th month of receiving those disability benefits, excuse me. For folks who are receiving disability, you are required to keep the Part A coverage, but you can at least delay enrolling in Part B. Okay, and that's the one that has the premium. So let's talk about your initial Medicare enrollment period. It is 7 months long. So as I mentioned, it's not just that first 3 months before you turn 65, okay? So if you meet any of the following criteria that I'm about to list off and you say, "Oh yeah, that's me." Well, you would need to sign up during your initial enrollment period for Medicare. 7 months long. We'll talk about what that scope of time looks like. But if you are not actively working, you don't have group health insurance through an employer with more than 20 employees or 100 employees if you are under the age of 65, if you're on the expanded medical assistance, if you're on a qualified health plan through the exchange, if you're retired and have a retiree health benefit, if you're on COBRA, or if you're working as a contractual employee without group health benefits for that employer. If any of those things made you say, "That's me," you need to sign up during your 7-month IEP. And it's the 3 months before you turn 65, the month of your 65th birthday, and the 3 months after. You need to sign up for A, B, and D, which is your drug coverage, during this time period to avoid any late enrollment penalties. I will allude to what the late enrollment penalties look like, but then I'll share with you how bad they can actually be. Okay, so please take it seriously. We hear all the time, "Oh, I didn't know I was going to be penalized." Well, here I am right now telling you. Okay, so we want to make sure that we sign up sooner rather than later. And remember, too, when you sign up will determine if you're going to have a lapse in coverage or not. So if you sign up in the 3 months before your 65th birthday, Medicare starts the month you turn 65. If you sign up in the month of your 65th birthday, Medicare starts 1 month later. And if you sign up in the 3 months after your 65th birthday, Medicare starts the first day of the month after you sign up. Okay? So just remember, like, if you, let's say, aren't working, okay, you don't have that active employer benefit, all right, and you decide to wait until the 3 months after your 65th birthday, well, if you don't have health coverage, you're just continuing on without health coverage, right? And I always find that when we don't have something lined up, that's when something's going to go wrong. Okay, so take the initiative and help really invest in your own health and well-being. So what if we plan to work beyond the age of 65? The workforce is aging and, it's a great thing. We've got all this institutional knowledge and all of these different agencies and companies, but there also becomes a lot of questions about, well, what am I supposed to do with my Medicare then if I keep working? Do I need Part A? If you or your spouse is actively working for an employer that has more than 20 employees or 100 employees if you are disabled, and they provide group health coverage, there's no reason not to take Part A. Remember, though, as I said earlier, if you are receiving disability benefits, you have to keep Part A. Okay, you don't really have a choice. But remember, Part A doesn't cost you anything. It's premium free. So there's no premium. That means you don't pay something every single month to keep that insurance active. You just have it, which is really nice. Okay. Part A would wind up being secondary to the active employer benefit that you have. And P.S., what if it winds up covering something that your other insurance doesn't? And again, you're not paying a monthly fee to have it. That's all good stuff, no matter what way you look at it. The only reason you wouldn't want to take Part A is if the employee health plan that you have is a health savings account with a high deductible health plan. You may only continue contributing to your health savings account if you're not on Medicare. Beyond the age of 65, you have to stop contributing to your health savings account 6 months before you want Medicare Part A to start in order to avoid an IRS penalty. Okay. Now you can still pull funds from the health savings account to pay for Medicare and other health costs. You just can't put funds in, if that makes sense. I always tell people too, if you think you might fall into this category regarding the health savings account, you might want to talk to your HR office or your benefits office where you're working. Now, if I'm working, do I need Part B? Because remember, Part B does have a premium. So a lot of people don't want to pay 2 sets of premiums if they don't have to. So let's talk about this. If you're 65 or older, you can delay enrollment in Medicare Part B without fear of penalty if you or your spouse is actively working for an employer, you have employer or union health coverage through that same employer, and the business has 20 or more employees. If you are a younger person who has a disability, you may not need Part B because, again, you have a family member who's actively working for an employer who has group health coverage and the business has 100 or more employees. If you don't need Part B, but let's say you were getting a Social Security check, so you were automatically enrolled in A and B. You can follow the directions on the back of the Medicare card to decline Part B at that time and then sign up later. We'll talk about that process. Or better yet, if you are actually signing yourself up, well, just sign up for Part A and don't even worry about Part B until you need it. Now, you can enroll in Part B at any time while you're working and covered by the employer health insurance, but you'll also have access to an 8-month special enrollment period, a SEP, in order to enroll in Part B without a penalty. And that's from the date that you no longer have your health insurance through your employer or union based on your active employment. So this is really, really important. The other thing as well that I always tell people, again, I'm very much a time frame and timeline person. Even though you have this extra 8 months, that 8 months will fly. So I usually recommend that people get started a little bit before you are planning to retire, if at all possible. You're going to need 2 forms, okay? And these forms are what really enables you to sign up for Part B without a penalty. The first form is the CMS 40B form. The second form is the CMS L564 form. The 40B form is for you. That's you saying, yep, I am ready to sign up for Part B. The L564 form is for your employer. And that's for your employer to say, yes, this person has been employed, or maybe their spouse was employed, and they had an active employer health benefit through us since the age of 65. Just proving that no, you should not be penalized because you had creditable coverage. So to sign up for Part B, okay, you can send the forms by certified mail to your local Social Security office. You can fax it, and the fax number that we have is 1-833-914-2016. Now, I will say this fax number does work. We've tested it, so it's not like I'm just throwing a number up here that we haven't tried. You can also complete the process online through ssa.gov. Super user friendly, very easy. Highly recommend just doing it online. It's really nice too. If you have an email address, you will have to have an email address to put that in. They then send you a receipt that everything's been received, so you can keep that for your records as well. Now, what if you're in a situation where maybe for whatever reason or another, maybe like HR is on extended leave and no one can fill out the, L564 form for you, okay, their form. You just have to provide one form of secondary evidence of coverage since you turned 65. That could be a copy of your pay stub that is showing the health insurance premium coming out, or even a copy of your health insurance card. Okay, so all that's fine. And it would need to be included whether the information is being mailed, faxed, or if it's being submitted online, just make a copy of it and upload the PDF. But that's only if you don't have the employer's signature on the L564 form. Sometimes people do it all anyway, and they submit extra stuff just to be sure. Whatever you want to do, whatever makes you feel better, that's fine. Now let's talk about who's primary. So if you or your spouse is actively working for an employer with 20 or more employees, and you're covered by an employer or union health coverage, the employer health insurance that you have is primary and Medicare is secondary. And if you're someone who's under the age of 65 receiving disability benefits, the employer with 100 or more employees, that health benefit is primary. And again, Medicare is secondary. The day after you, your spouse, or your family member stops actively working, Medicare then becomes primary. And if you have a retiree health or drug benefit, that then shifts into the secondary role. Now, let's talk about the general enrollment period. Maybe you were someone who continued to work past the age of 65. Okay, so the initial enrollment period, you didn't really need need to worry about quite so much. Let's say you got Part A, but you didn't get Part B because you didn't need it. You had that active employer benefit. Well, then you retire, but you say, oh, I've got an 8-month special enrollment period for no penalty. I'm just going to do it during that period of time. Well, sure enough, that 8-month period of time comes and goes because you're just so excited to be retired. You can still sign up for Part B. You have the option every single year during what's called the general enrollment period. It runs from January 1st to March 31st, and then the coverage begins the month after your enrollment. But because you have now waited, some time, it could be that now you will have a penalty. Okay, so just keep that in mind. And I said earlier, I know I allude to the penalty. How bad can it be? It can be pretty darn bad. Okay. So for each full 12-month period that you could have had Part B, but you didn't sign up for it, your Part B premium may be increased by 10% per month for as long as you live. It is a lifelong penalty. Okay. So if you go years and years and years and years without Part B, maybe you have the mentality of, I'm healthy, I don't need it. Well, when you finally need it, now it's really going to cost you a lot of money. Okay, so really the best bet is to just get it up front. Okay, so now we're going to get back into really the nitty gritty of what's covered under A and B, as well as the financial aspect to each of these parts of Medicare. So as I mentioned earlier, Medicare Part A is everything inpatient. That's your inpatient hospital care, skilled nursing care, home health care, and hospice care. I did mention earlier it's premium free for most folks as long as you've worked 10 years or 40 quarters. Some folks, though, can purchase Part A if they don't have the 40 work quarters. If you worked less than 30 quarters, it's $505 per month, and it's $278 per month if you worked between 30 and 39 quarters. Now, there's a lot of flexibility that you get with Medicare Part A. You can go to any facility or provider that accepts Medicare. And then this is some updated information regarding 2024 costs for Part A. There is a $1,632 deductible for hospital stays up to 60 days, and that's per benefit period. Now, most people, well, I would say most folks are used to deductibles being a one and done. You hit it once, and then you're good for the rest of the year. Well, that's not really how Part A works. Part A says if I'm in the hospital, let's say for a couple days I hit this deductible, I have to pay that deductible out of pocket. So $1,632, okay, that's a solid chunk of change. But then I'm discharged. But then let's say 90 days later, 3 months later, I'm back in the hospital. Doesn't matter if it has anything to do with the first admission or not. Okay. I actually have to hit that deductible all over again because there's over a 60-day period of time in between the first admission and the second admission. Okay. So a lot of people think deductibles are one-stop shop. You hit it once, you're good for the year. Not for Part A. It's $408 per day for days 61 through 90, and it's $816 for each of your 60 lifetime reserve days. Those lifetime reserve days are really there to extend your Part A benefit in the event that you need it, right? You've been in the hospital for, let's say, 90 days, but you need a little bit more time. Well, there's your lifetime reserve days. But once you start chipping away at your lifetime reserve days, they will never replenish. If I go from 60 to 55 and then I'm discharged, they now sit at 55 until I need to use them again. Now let's talk about skilled nursing stays. I want to talk finances first, and then I'm going to get into some stuff that's a little funky with the skilled nursing stays. It's $0 for the first 20 days of each benefit period, and then it's $204 per day for days 21 through 100. But where things get a little wacky is that in order for Medicare Part A to pay for you to be cared for in a skilled nursing facility, you have to have been admitted to the hospital for 3 midnights. And that does not include any time that you spent in the emergency room or if you were being treated at the observation level of care, because both of those services are covered under Part B. So the question becomes, how am I supposed to know if I'm inpatient or observation? Do they look any different? Nope. You could be put in a room You could still be visited by doctors and nurses because they have to get you care, give you care. It's not like they're just rolling you into a closet and saying, yeah, we'll come check on you every so often. That's not how that works. You're still getting the care that you need. It's just considered a lower level of care at the observation level versus being formally and fully admitted at the inpatient level of care. It always goes back to billing, okay? But again, how am I supposed to know the difference? Well, hospitals are required to tell you if you are being treated at the observation level of care, you should be given what's called the MOON, MOON. It's the Medicare Outpatient Observation Notice. Okay. It basically helps to spell out that you are being kept at the observation level of care. And really, it also goes over implications of okay, Part B pays for observation, Part A pays for inpatient. And what happens if you've been in observation and then you need to go to a skilled nursing facility, right? Because remember, if you've only been in observation, even if it's 3 midnights in observation, and then you need to go to a skilled nursing facility, Medicare Part A is not going to cover it. Okay. Now, you or your representative working on your behalf is required to sign the Medicare outpatient observation notice just to make sure that that can be filed away with your record. Now that brings us to Medicare Part B. So what does Part B cover? That covers doctor services and outpatient care from any provider that accepts Medicare. Again, lots of flexibility. This includes things like preventative services. Get your preventative services, folks. Can't harp on it enough. Diagnostic tests, some therapies like physical therapy, occupational therapy, and speech, home health care, durable medical equipment, otherwise known as DME. That's things like hospital beds, wheelchairs, walkers. The premium, as we discussed, is $174.70, but you can have a higher premium if your income is over a certain threshold. As we discussed, for a single individual, it's $103,000 a year. For a married couple, it's $206,000. Now, COVID is still with us, so I still like to touch on COVID and the test coverage because that changed last year, but I still like just making sure that we talk about it because not everybody knows that those changes have happened. So Medicare does not cover at-home COVID tests. They only cover COVID tests that are performed by like your physician, right? So let's say you go to your doctor because you're feeling under the weather and they do a COVID swab. Well, that would be covered under Medicare Part B. During the COVID-19 public health emergency, when that was in effect back in 2023, and prior to that, folks were able to actually get the over-the-counter tests covered by Medicare as well, but that was stopped back in May of 2023. And I always tell people too, if you're on an Advantage plan, a Medicare Advantage plan, just check with your Advantage plan to see what kind of COVID test coverage they have. So for Part B services in 2024, Part B has a separate deductible from Part A, and the Part B deductible is $240 annually. So that's you hit it once and you're good for the rest of the year. And there's also a 20% coinsurance for most Part B services if your provider accepts assignment. We'll talk about that in a little bit more detail in just a second. Just like to touch on this quickly. If you're someone like me, my smartphone is literally sitting right next to me. Part of that's because I have small children and I need to make sure that they are okay at any given time. But also, I love having information at my fingertips. Knowledge is power. And if you are the same type of way where you like having stuff readily available to you, Medicare actually has an app now. It's not, I will tell you, when you go to the App Store or Google Play to download it, it's not quite as intuitive to recognize because the logo is green and blue rather than red, white, and blue like the actual Medicare card. So sometimes I find that that can be a little confusing for people, but you can learn about different items and services that are and are not covered by Medicare A and B, general costs, how often you can get these covered benefits in your preventative services, all good stuff. So highly recommend checking that out if you want to. But let's go back for a second to this idea of assignment. What does that mean? So a doctor or provider who accepts assignment and participates in Medicare is agreeing to accept the Medicare approved amount for a service or item as the payment in full. Wow, that was a lot of words. So what this actually is a demonstration of in word form is the Medicare 80-20 rule that a lot of people are familiar with. Medicare pays 80%. You as the beneficiary pays 20%. And guess what? That equals 100%. Now we just hope everyone's happy with their care. Essentially what these doctors are doing who accept assignment is they're saying, yes, I will take Medicare patients. Yes, I will bill Medicare. And yes, I agree with what Medicare says I should be paid. Great. There are doctors out there who do not agree with what Medicare says they should be paid. So those doctors are called non-participating. Little misleading because it doesn't mean that they're not participating actually with Medicare. You can still go to those doctors. You're just going to pay a little bit more money. So let's talk about these. A non-participating doctor or a doctor that doesn't take assignment, they say, yes, I accept Medicare. Yes, I will bill Medicare, but no, I don't agree with what Medicare says I should be paid. I want more. Well, who pays the more? You do as the Medicare beneficiary, and you could be charged up to an additional 15% on top of your 20. Okay? Opt-out providers, these are providers that really don't accept Medicare at all, okay? You're going to pay the entire cost and Medicare is not going to reimburse you, okay? You can still go to opt-out providers, but choose wisely because it could be expensive. Concierge or boutique doctors. This is kind of a relatively new movement, but it's gaining a lot of traction. Now, concierge doctors are typically covered under Medicare and they accept Medicare patients, but they may offer special services that would not be included. Maybe a concierge doctor would offer something like access to the doctor's personal cell phone number for a price. Well, that's great. You might say, yeah, definitely worth it to have my doctor, at my beck and call like that. However, that is not something that's billable to Medicare, and you would be paying out of pocket for that boutique service. Okay. Durable medical equipment, prosthetics, orthotics, and supplies, DMEPOS for short. In Baltimore County, you need to see a Medicare contract supplier to purchase over-the-counter back and knee braces if you want Medicare to pay their 80%. If you get a phone call from someone saying, I think you could use an over-the-counter back or knee brace, hang up, it's a scam, okay? Remember, if the provider does not accept assignment for that particular DME item, there's no limit as to how much the price may be raised. So again, those scam callers, you don't know if they accept assignment or not. Okay, so you could be paying a pretty penny out of pocket for that when you don't have to. If you're looking for a reputable DME supplier in your area, recommend checking out medicare.gov/supplier. Very, again, user-friendly tool that Medicare has created for beneficiaries to be able to find suppliers in their area. So highly recommend checking out that as a resource. And really, the medicare.gov website is awesome when it comes to information. It's a user-friendly site to navigate. Definitely recommend that as a resource for you. Preventative services. And you already heard me say, get those preventative services, folks. They're good things. So Medicare covers many preventative services without additional copays. Diagnostic services are also covered, but they do have payment of copays. And there's really a difference between the two. So something that's preventative is really when you don't have any prior symptoms or conditions. But diagnostic services are really addressing symptoms or conditions that you already have. Now, I mentioned earlier, preventative services have no copays. Diagnostic services do have copays. You can go in for something, though, that is preventative in nature, turns diagnostic during the procedure, oops, and now you have copays, okay? So prime example is a routine colonoscopy, all right? So a routine colonoscopy is something that is considered a preventative service. You're not having any other issues that would lead you to believe that anything's going on. But then something is found. Well, if something's found, you really want that sent out for diagnostics because you want to make sure it's not something more serious. Well, once a diagnostic service needs to be performed, you will now have a copayment for that service. Okay. However, I always tell people that should absolutely not discourage you from getting those services. You want to find that kind of stuff sooner rather than later. So let's talk about some preventative services that are covered under Medicare. We've got our Welcome to Medicare visit and your annual wellness visit. Neither of those things are annual physical exams because Medicare does not cover annual physicals. That's like just the full workup with like the EKG and all that kind of stuff, not covered. Flu shots and pneumonia shots are covered. Sometimes I have people right here that stop me and they say, well, where's all the other shots I'm supposed to get? Like the shingle shot, prime example, right? Uh, that shot is actually, or vaccine, I should say, is covered under Medicare Part D. Some vaccines and shots are covered under B, some are covered under D. Okay, so just keep that in mind. RSV is actually something that's newly approved to be covered under Medicare as well. Bone mass measurements are covered if you have risk factors. Lung screenings are covered. Diabetes screenings are covered if you have risk factors. Mammograms are covered, as well as pap smears, pelvic exams, and breast exams every 2 years if you're at a low risk for cancer, and every year if you're at a high risk. So what does Medicare not cover? Long-term care, routine physical exams, as we mentioned, or an exam that's requested by a third party, such as your job, routine dental care and dentures, hearing aids and exams for fitting hearing aids, routine eye exams and glasses. We've got acupuncture. That's covered, but only for lower back pain. So if you were trying to get acupuncture for like migraines or GI issues or something, not going to be covered. And last but certainly not least, Medicare does not cover cosmetic surgery. I'm very sorry if I burst any bubbles today. Now you might be thinking, okay, wow, there's premiums, there's deductibles, there's co-payments, there's these co-insurances. How can I decrease my own out-of-pocket expense? We'll talk about it. So first up is retiree health offerings. Not every company offers it, but if it does, it might be worthwhile for you to explore. Retiree health benefits are secondary to Medicare the day after you stop working. They can be offered again by all sorts of different entities. If you worked for local government, federal government, maybe you have TRICARE from career and military, you've got access to the VA, or maybe your private company that you worked for offers a retiree health benefit. If you have any questions about your specific retiree health benefit and how it works with Medicare, you have to contact your benefit administrator. Okay, so I'll use the county, Baltimore County, as an example. If you retired from Baltimore County, you have to contact Retiree First. It used to be called Labor First, but now it's called Retiree First. Okay, and if you go to the Baltimore County government webpage and type that in, you'll find it. Okay, so they're the ones who oversee all of our retiree health benefit options. So just keep that in mind. Let's move on to Medicare supplement plans, okay? They're also known as Medigaps. They range from letters A to N, and each lettered plan covers a different mix of Medicare deductibles and costs. So I'm just going to scoot forward just for a second, and then we'll go back because I like people to see this. Now, this is a page that's actually taken directly from the Medicare Supplement Premium booklet that's put out, I believe, twice a year by the Maryland Insurance Administration, January and July, so start of the year midpoint, okay? Just to see, okay, look, here we have A, B, D, G, K, L, M, N, and then C and F are broken out all the way over here. C and F are broken out over here because they're not available to people everybody anymore, I should say. Okay, not anybody, but not everybody. So what that means is that if I'm newly 65, let's say I turn 65 tomorrow, I can't get a C or F policy. Okay, I can only shop from these guys over here to the left. If I turned 65 prior to January 1st, 2020, but maybe I've just been working, okay, wasn't quite ready to retire, that's fine. Well, when I finally do retire, I could look at C or F policies to see if that might be up my alley, okay? Most folks who are newly 65, we're seeing them go with the the G policies here. Okay, the only thing it doesn't cover is the Medicare Part B deductible, which we talked about in 2024, will be $240. The N plan is also popular. Won't cover the Part B deductible, which you'll notice is across the board for all of these policies. It won't cover excess charges. Excess charges means if you saw a doctor who didn't take Medicare assignment, that extra 15% that they can tack on, you would be responsible for, and then you would also be responsible for co-pays. Okay? So let's come back to this though. The plans that are offered by different insurance companies are all standardized. So let's say I know I want a G plan. I'm newly 65. The G plan gives me the best coverage I can get. But there are many different insurance companies that offer G plans. So how do I know which one to choose? We get that question all the time. It's up to you, because the fact of the matter is, if you are comparing a G plan from one insurance company to a G plan from another insurance company to a G plan from another insurance company, it's apples to apples to apples. It's the exact same product, but they all might cost something different. So some people say, I'm going with this company even if it costs me more money because I trust the name. Some people say, I'm going with this company because it's the least expensive. It's really up to you. Okay, there's no right or wrong answer. Okay, you just have to know what type of letter you want. And once you make that selection, just figure out what insurance company. If you want to go with the least expensive, go for it. The policies are written based on attained age, issue age, or they can be community rated. There's one insurance company in the state of Maryland that is community rated, and that is United Healthcare, AARP. They've got the biggest pool of people. Okay, huge. Everybody knows ARP. Now, the other thing as well that's important to remember is that these Medicare supplement plans don't make coverage decisions. So what that means is that if Medicare says, oh yeah, no, that's not covered, we're not going to pay that, your Medicare supplement plan is also going to say, yeah, what they said, we're not going to pay that. Okay, so keep that in mind. They're not going to swoop in when Medicare says no. Okay, we talked about all this. Now, when can you sign up for a Medicare supplement plan? This is very important. You have 6 months from the date that your Part B starts, okay? And during that time period, you can sign up for any Medicare supplement plan that companies sell, even if you have health problems, and they can't charge you more because you have health problems during that 6-month period of time. We call it the guaranteed issue period because you are guaranteed to get a Medicare supplement plan without any hangups, basically. Now, this is new. It just started July of 2023. We have access in our state now to what's called the birthday rule. Okay, for more information, you can visit the Maryland Insurance Administration website. But what the birthday rule says is that Medicare beneficiaries who are already in a Medicare supplement plan can change their Medicare supplement plan as long as that switch is deemed of equal or lesser value. So let's say, I'm just going to use this as an example. And with the caveat, it has to be done in the 30 days following your birthday. Okay. And you can't be medically underwritten during that 30-day period of time. So very quick turnaround time, but it can benefit you financially. I mean, let's say I've got a G plan through XYZ insurance company, and I'm just saying, wow, this is so expensive. But I was doing some research and saw, hey, I could get it from ABC insurance company, same coverage, because we know a G plan is a G plan regardless of the cost. Well, if I switched, it would be so much less expensive. Well, in the 30 days following my birthday, I give insurance company ABC a call and say, I'd like to switch to your Medigap policy, please. And there you go. Now you're in something that for at least the next year, until if you decide you want to change the following year, because you have this birthday rule opportunity every single year in the 30 days after your birthday. But again, it's basically just an opportunity where we as the consumers have a little bit more control, which is nice, because it used to be when you would hop into a Medigap, that was it. You were in it to win it, okay? Until possibly you were eventually priced out. But now things are really changing, which I'm hoping helps to make the market a little bit more stable. Now remember, If you are someone who said, I'm healthy, I'm not getting a Medigap, well, that's fine. But remember, down the road, if you decide, well, maybe I should get a Medigap, well, now companies don't have to sell to you. If you are outside of that 6-month window from this day that your Part B coverage started, plans don't have to sell to you anymore. And if they do sell to you, they're going to medically underwrite you to determine what that cost is going to be. Okay, so keep that in mind. If you're someone who's receiving disability benefits, you have the opportunity to get a Medicare supplement plan, but they're only required to sell plans A and D to folks who are under the age of 65, as long as they are also offering those policies to folks who are 65 and older. But the premiums are really, really expensive, which I know can be a bit of a challenge for folks. If you were someone who, let's say, became disabled closer to the age of 65. Well, then when you turn 65 and technically age into Medicare, even though you were already on it, you are what's called, or what I like to call, being clean slated. Okay. You have a clean slate. Okay. Because you were on Medicare as a result of a disability, but now you've aged into Medicare as well because you just turned 65. That gives you a brand new opportunity, brand new 6-month period to hop into a new Medigap. So you can go from an ultra super expensive Medigap A plan, which is really pricey and not a lot of coverage, to now being able to get something like a G plan, not being medically underwritten and much more cost effective. Okay, better coverage. Now, moving on, let's talk about Medicare Advantage plans, one of those hot topics. In order to sign up for a Medicare Advantage plan, which is also known as Medicare Part C, you have to be on A and B first. These Medicare Advantage plans act as a substitute to original Medicare. Okay, so while you're still technically in Medicare A and B out there in the background, it's your Medicare Advantage plan that's really at the forefront. So when you go to the doctor, when you go to the hospital, you should be presenting your Medicare Advantage plan card. Okay, so if I'm on Kaiser, I need to show my Kaiser card. If I'm on one of the Hopkins plans, I need to show my Hopkins card. Okay, they can include extra benefits like dental, vision, and hearing, and the coveted routine physical exams. And they typically have low monthly premiums because they're subsidized by the federal government. When you have a Medicare Advantage plan, you pay out of pocket at the time of service. They're typically co-pays that are required to be paid at the time of every service, but there is an overall limit to the annual out-of-pocket expenses. And I want to say it's over $8,000 right now. I just can't remember what that is. Now, before joining a Medicare Advantage plan, okay, check with your doctor or any doctors and specialists really that you see to make sure that they participate with that plan. And you need to be very specific. You can't just say, do you take Aetna? Because Aetna is a huge company, right? You need to know, okay, you don't take Aetna. Do you take the Aetna, Medicare Advantage, yada, yada, yada. Okay, you need to be very specific. You want to check to be sure what hospitals participate with the plan. Make sure that any prescription drugs that you take are on the plan formulary. If you're in an HMO, you have to go in network, and you're typically going to need referrals to see specialists. PPOs, you can go out of network if the provider accepts the plan, but you're definitely going to be paying for it. And almost every single Advantage plan offered in Baltimore County are HMOs. I think the only PPO is through Hopkins. Now, there's also special Advantage plans that are called special needs plans. There are some that are designed for folks who are chronically ill. There are some that are designed for folks who are on financial assistance programs like Medicaid and QMB. Cigna has one that's designed really specifically for folks who have diabetes, and then there are several different special needs plans designed for folks who are on medical assistance and or QMB. Cigna's got one, Care First has one, Johns Hopkins, brand new in 2024, has one, United Healthcare has a couple, and then Alderwood has one as well. Okay, so there's a bunch of different ones out there. Now, when you were first eligible for Medicare at the age of 65, maybe you heard from a whole bunch of friends before you became Medicare eligible all about Advantage plans. You said, I'm going to give that a try, because a couple of my friends are in it and they say they love it. If you joined a Medicare Advantage plan and within the first 12 months of joining, you said, you know, this just isn't for me, that's okay. You can still go back to original Medicare and get a guaranteed issue period to purchase any Medigap sold in Maryland, and it lasts no later than 63 days after the coverage ends from your Medicare Advantage plan. So keep that in mind. It's called the trial right, just giving you the opportunity to do exactly what that says. Try it out, see if you like it, and if you don't, you have the opportunity to come back. All right, let's talk about Part D. So we talked a little bit about the initial enrollment period earlier. It feels like it was so long ago at this point during the presentation. This is your time frame to sign up for Part D or Advantage plans without a penalty, and it's the 3 months before the month of your 65th birthday and the 3 months after. And again, we can also use the time frames of the 25th month of receiving disability benefits as well for that. The annual open enrollment period happens every fall, and that's for Medicare Part D or Medicare Advantage plans. Super, super important. You will know it's happening because there will be radio ads and things coming to your house in the mail and lots of commercials on TV and probably unsolicited phone calls. It gets to be a little overwhelming, but it's a really, really important time of year. It runs from October 15th through December 7th, but it's your chance to join, drop, or switch a Part D or Advantage plan. And any changes that you make become effective January 1st. I hear from people all the time who say, I like my plan. Well, that's fine, but what happens if your plan doesn't like you, right? If your plan doesn't like you anymore, that's going to be a bit of a problem. And I'd want to know that and get all my ducks in a row lined up for the year ahead sooner rather than later. Because once you're past that December 7th deadline, that's it. You can't make any changes and you are stuck in your plan for the remainder of the following year until the next open enrollment season comes around. So please always take that opportunity, see if your prescriptions changed, and even if they haven't, would another plan be better for you? Now, let's see here. So, how does someone get Medicare prescription drug coverage? It comes through Medicare prescription drug plans, which are the standalone Part D plans, Medicare Advantage or other Medicare health plans, but prescription coverage is not offered through Medicare supplement plans. Just like with Part B, if you wait to sign up for Part D, you can also be subject to a late enrollment penalty if you didn't sign up for prescription drug coverage. We have a lot of people who say, one, I didn't know I needed a drug plan. Two, I didn't take any medications for 10 years. Well, that's great, but now you're going to be penalized because you didn't sign up when you were supposed to. If you're someone who says, I don't take any medications, sign up for the least expensive plan. Next year in 2024, the least expensive premium, the lowest premium, is 40 cents every month. 40 cents. It's $4.80 for the entire year, full 12 months. Okay. So just sign up for that. It's a placeholder. Okay. Because what you don't want to do is say, forget it, I'm not paying anything, need it, and then wind up getting hit with a penalty. No fun. Add 1% of the national base premium, which is $34.70 in 2024, for every month that you were eligible but not enrolled. That's what the penalty looks like. So if you go year after year after year, they go on a per month period of time. Okay. So that can add up really quick if you are, 10 years down the line and you haven't had a drug plan and now all of a sudden you need it. And you would pay that penalty as long as you are enrolled in a drug plan or an Advantage plan. Don't think because you're in an Advantage plan, you're getting out of the penalty. They'll give it to you no matter what way you have it. Now let's talk about the basic structure for Medicare Part D. I love this slide because it really does not look very basic, but that's okay. The deductible in 2024 is $545. The initial coverage area is next, followed by the coverage gap, which used to be known as the donut hole, followed by catastrophic. So let's break these all down. Deductible again, $545. Initial coverage area, is $545 to $5,030 in total drug cost. During this time period, the beneficiary is paying less than 25% of retail costs for brand name drugs and between 0 and 100% of retail for generics. Coverage gap is when people start to have issues. Okay, that's $5,030 to $12,447. Again, not what you're paying out of pocket. It's not your out of pocket cost. It's the total retail cost of your meds. So if you're someone who's taken some pretty expensive medicines, well, you might, hop into this coverage gap sooner rather than later. For the coverage gap, this is where now you are paying 25% of retail for brand and generic drugs. So if we're talking about a brand name drug that's already really expensive and now you have to pay, it's got a high retail cost. Now you have to pay 25% of a high retail cost. You're going to feel that at the pharmacy. Okay. Catastrophic coverage is once you reach that $12,447 amount. Beneficiaries who hit catastrophic coverage will no longer have to pay co-payments or coinsurance for covered Part D drugs for the rest of the year. If I was someone who was taking some expensive meds, and let's say I hit catastrophic coverage in July, from July until the end of December, I pay absolutely nothing for every single one of my covered medications. Okay, very important. The donut hole closed back in 2020, but if we all might remember, there was kind of a lot going on in 2020. So I feel like the closing of the donut hole was a little overshadowed, which is fine. There was bigger things happening. But now, rather than the donut hole, we have access to what's called the coverage gap, which means that you're still covered under your prescription drug plan, but you're responsible for a higher amount during that period of time. Okay, 25% of the retail cost for brand and generic drugs. During the coverage gap phase, though, manufacturers are also paying 70% of the retail cost of those brand name medications. And that's counted towards your out of pocket costs. So you're going to hit catastrophic coverage a lot sooner than what you would think. A lot of people look at this $12,000 amount and they say, I have to spend what out of my own pocket to hit catastrophic, or it's got to cost what? You're spending closer to $3,300 out of pocket to hit catastrophic. I'm not saying that's not a lot of money, but it's a lot better than what it could be. The true out of pocket amount looks like $8,000, but you're not paying that out of pocket. It's around $3,300. Now, Medicare Part D plans in 2024. There are actually 19 standalone prescription drug plans available to beneficiaries. The premiums are as low as 40 cents a month and as high as $113.40 per month. Okay. Now, not everybody is recommended that super high premium plan. It's all based on your medications and the pharmacy where you get them filled. Most plans do have a deductible, but some plans have a lower deductible than that standard 545, and some have none. Okay, it just depends. But sometimes folks will call our office and say, I want a plan with no deductible. Well, if the plan with no deductible doesn't cover your medications, you're probably not going to want that plan. Okay, so just keep an open mind. The prescription drugs that you take as an individual determines which plan is best for you. And also, don't be afraid to shop around pharmacies too, because not all pharmacies play nicely with all the different drug plans. And the plans change every single year. Okay. And what they cover changes every single year. So it is so important to reevaluate your Part D options when open enrollment comes around. You can sign up for a Medicare.gov account. It is free. It's a great place to do research on your Part D plan, Medicare Advantage plans if you're interested. You can even enroll online. You can also print copies of your Medicare card at home, pay Part B premiums, review claims, which is super important when we're talking about fraud. And there's a chat function. So if you wanted a quick question answered, a Medicare representative might be able to give you a quick response via their chat function. Now, some prescription drugs are subject to different restrictions. So, some drugs are subject to what's called prior authorization. Some can be subject to quantity limits. Maybe you can only get 30 pills in 30 days if it's a controlled substance. Okay. Some drugs are also subject to what's called step therapy. If you have a formulary drug that is subject to step therapy, you are required to try a less expensive medication first before your drug plan will pay for the formulary drug that you were originally prescribed. You will be able to see on Medicare.gov on the plan finder, which is available to the public, if that's going to impact any of the medications that you take. Okay? You're probably going to want to know that. Now, I know we talked about how in the fall for open enrollment, the different prescription drug plans and advantage plans are really coming out with all their updated information. Um, this isn't the only time that they can make changes to their formulary. So, Medicare Advantage plans and Medicare prescription drug plans are able to immediately substitute newly available generic drugs if they're on the same or lower cost sharing tiers, and they don't have to notify you that they are doing that. Okay. Some plans use a general notice saying, hey, we do mid-year formulary changes. If they do, they have to provide a 30-day supply of the brand name drug. Okay. We also recommend, if you're interested, filing what's called a formulary exception. You're basically writing your plan to say, I need the brand name drug, and here's why. Okay. You may or may not succeed. It's not a guarantee. Always, though, get the help of your physician. All right. We are almost done, folks. So we've got some descriptions of different financial assistance programs I want to go over. I'm going to touch on fraud, and then we'll be finished. So let's talk about Extra Help. Okay, Extra Help is a federal financial assistance program, and it's administered by the Social Security Administration for folks who have a low income who are on Medicare Part D or Advantage plans. What it does is it assists with the cost of Medicare Part D premiums, deductibles, and copayments, and you can apply online at ssa.gov or call Social Security. You can also call the SHIP office. I'll give you our information at the end, and we can actually submit the application over the phone. You just have to know all of your financial information so that way we can screen you and make sure it's appropriate for us to submit the application. Now, there's some new things with Extra Help, which is very exciting, that have come about in 2024. There used to be two types of Extra Help, partial and full. And to qualify for partial Extra Help, it wasn't the same benefit. It was much more limited, but it had a higher income and asset limit than full Extra Help. Now, if you were able to financially qualify for partial Extra Help last year, you will automatically be enrolled into full Extra Help in 2024. Good stuff. So the benefit of partial Extra Help is going away, but the full Extra Help benefit is being expanded to more people. So now, rather than partial and full Extra Help, it's just Extra Help. Okay. So this is Extra Help and what the benefit looks like. There's typically no premium, no deductible. Generics would cost you no more than $4.50 per month, and brand name drugs cost no more than $11.20 per month. Good stuff. Okay. You also don't have to worry about the coverage gap donut hole area. Now, to qualify for Extra Help, for a single individual, your income maximum can't be more than $1,843 a month, and that's gross income before anything comes out. Assets have to be under $16,660. For a married couple, your income maximum has to be under $2,485 a month. Assets have to be under $33,240. Now, new income and asset criteria will be available at the start of 2024. We're just waiting for that information to officially be released. So the information that you see here is the partial Extra Help numbers from 2023. Okay, but typically these all update as Social Security rates start increasing because everybody did get an increase for 2024. If you are on Extra Help, you can change your Part D or Advantage plan once per calendar quarter, and that's during the first 9 months of the year, and the fourth quarter is during open enrollment. So we'll talk about in just a minute why someone might want to change their plan if they're able to outside of open enrollment. But first, I want to talk about the Senior Prescription Drug Assistance Program. This is a state of Maryland benefit. You have to provide proof of Maryland residency of at least 6 months. They're going to look at your income, but they don't look at assets. So if money in the bank would have otherwise been an issue for you qualifying for extra help, you might want to look at this program. Right now, the income maximum for a single individual is $43,740. For a married couple, it's $59,160. Okay, and that's per year. It will be going up again once the new rates are sent out. I believe they usually come out with their rates somewhere in March, if I'm not mistaken, once the Social Security income changes have all come through. So assets, again, are not counted. So if you had things like money in the bank, real estate, whatever, that's not going to hurt you. They're just looking at income. The state will pay up to $75 per month towards your Part D premium. Okay, that's awesome. It also makes it so you can switch your Part D or Advantage plan one time outside of open enrollment. Good stuff. So let's come back to why would I want to change my plan outside of open enrollment? Well, remember, open enrollment runs from October 15th through December 7th. What happens if our medications change in the new year? And guess what? The plan we picked doesn't cover that drug. Well, we have an opportunity if we participate in the Senior Prescription Drug Assistance Program or Extra Help to change plans and get something that will financially benefit us. Okay? Just keep that in the back of your mind. And this really is a great program. We've also got QMB, which is the Qualified Medicare Beneficiary Program. Some people call it QMB, okay? So it's all the same. 3 different terms for the exact same program. If you qualify for QMB, you would wind up getting a gray and white paper card in the mail. It is a state of Maryland benefit, a state of Maryland benefit administered through the Department of Social Services through DSS. This program looks at income and assets. For a single individual, income maximum can be no more than $1,235 a month. Assets have to be under $9,090. For a married couple, income maximum has to be under $1,663 per month. Assets have to be under $13,630. So again, assets are things like savings accounts, checking accounts, stocks, bonds, IRAs, all that kind of stuff. Okay. And income, when I'm talking about income maximums, it's still gross income before anything comes out. If you qualify for QMB, the state will cover your Medicare Part B premium, that $174.70 we talked about quite some time ago. All of your co-insurances, any co-pays, and any deductibles that are associated with either original Medicare A and B or a Medicare Advantage plan. And if you were someone that didn't have the working quarters for Part A to get it premium free, they will cover that premium as well. Okay, this program is great if you qualify. Then there's also the Specified Low Income Medicare Beneficiary Program, SLMB or SLIMB. It's what I call the sister program to QMB. It's still a state benefit administered through DSS. They still look at income and assets, and the asset levels actually stay the same between the two programs. But it's the income level that changes, and for SLMB, it actually goes up. So for a single individual, gross income maximum can't be more than $1,660 a month. For a married couple, it's $2,239 a month, but the benefit changes. Okay, the state will only pay for your Part B premium. But again, adding $174.70 back into your budget every single month is pretty darn good. Okay, you won't get any assistance though from SLIMB with any co-payments, co-insurances, or deductibles though. Okay, so just kind of keep that in mind. If you are on the Kaiser Medicare Advantage plan, they are the only Advantage plan that has a foundation that's actually built to assist members with co-payments. Okay, so if that's something you might be interested in looking into, you might want to check it out. Last but not least, I got to talk about fraud. Fraud is the intentional deception or misrepresentation made knowingly and willingly in order to secure some unauthorized benefit. And abuse is engaging in practices that are inconsistent with accepted medical or business practices. I always tell folks, you're the first line of defense against Medicare fraud, waste, and abuse. I'm going to take a quote from Hamilton, the musical, you were in the room when it happened. okay? No one else was. So you are the guiding light here, okay? And if you see something, say something. You're the only one who's going to know if you actually received those services that were billed to and paid for by Medicare. Never ever hesitate to check with your doctor because clerical errors happen. We are all human. We all make mistakes. And sometimes it's not intentional, but whether it's intentional or unintentional, it can still result in Medicare money being lost. Okay. I always tell people remember the 3 R's: record, review, report. So the first R is record. Take a little notebook with you when you go to the doctor's, right? What a concept. Write down what you and your doctor talk about, what tests were ordered, what happened during that appointment. So when you get your Medicare summary notice some months later, you'll be able to reference back, right? Medicare summary notices only come out quarterly. They don't come out every time you get services. So because of that, I mean, I don't know about you, but sometimes I can't even remember what I had for breakfast yesterday, okay? So it's a really good idea to just take a notebook with you, jot things down so that way you can reference it. Review, look at those Medicare summary notices. Even though they're not coming out every single month, they're coming out quarterly. Look at it. We had a huge influx last year of durable medical equipment scams related to continuous glucose monitors for folks who, in theory, should be diabetic, but guess what? Who aren't. They were just billed for it when they shouldn't have been, okay? Big influx of those, and we had a lot going on with at-home COVID tests back when the public health emergency was still in effect. Lots of scams are going on all the time, but if you don't look at your Medicare summary notice, you may never see it. And last but not least, report anything that you find suspicious. Contact Medicare, 1-800-MEDICARE, easy enough. And please also contact the SMP office. It's housed right here within the SHIP office for the Baltimore County Department of Aging, and the phone number is the same. So I always like to do a little pop quiz at the end. So I always like to say, okay, look, we'll do one that's easy. Name one of the 3 R's. We know there's 3 of them. It's record, review, report. So important. We're going to take it back to the beginning for a minute. In order for Part A to pay for you to be cared for in a skilled nursing facility, you need to be admitted as an inpatient for how many midnights? And that was 3, right? 3 midnights at the inpatient level of care for Part A to cover your skilled nursing facility stay. Last but not least, name something that's covered under Medicare Part B. You can test your knowledge here. You can get as detailed or not so detailed as you want. But remember, Part B covers any doctor services and outpatient care. Okay, so we could say something as easy as x-rays and labs, or you could get more specific and say mammogram. Okay, so there's all different services that are covered under Medicare Part B. I really hope that you found this presentation helpful. I recognize it is a lot of information. If you need us, please call us. Our phone number at the Baltimore County SHIP office is 410-887-2059. We also have an email address, medicareinformation@baltimorecountymd.gov. Just letting folks know, if you do call our email, or excuse me, if you call our email, if you call our phone number, please leave a message. Our phone line actually does not ring straight through to the office. We respond to calls in the order in which they were received by voicemail, and we will have one of our highly trained, absolutely incredible volunteer counselors reach back out to you. But if you want to listen to this information again, we record this presentation so that way it's available on YouTube, or if you're on social media, check out the Baltimore County Department of Aging Facebook page. We keep it there too, and we're constantly updating it to make sure that everybody has the information that they need. Everybody, again, thank you so much for listening in today. If you need the SHIP office, again, call us 410-887-2059. Send us an email, medicareinformation@baltimorecountymd.gov. Thank you and stay well.